Welcome to New York City Health and Hospitals, Kings County's YouTube podcast. I'm Antoinette Williamson, the Senior Director of Environmental Services.
And I'm Geraldo, Acevedo, the Director of Environmental Services. And we're taking over this episode.
Today we'll be discussing EVS best practices. One of the things that I think are the top 10, top 2 is hand hygiene. We don't realize how many germs we pass along. We touch our phones, we put things down, and hand hygiene will eliminate the spread of so many things. Even just touching yourself, touching your face. My mom was sick maybe during peak COVID, right?
Mm-hmm, yeah.
And she was a patient here in the ICU for about a month. And even taking her home and coming, and that was like my biggest thing, realizing how many people didn't wash their hands. And being a family member of a patient, especially in doing what we do, you pay attention to it so much more, and you realize, like, hey, you didn't change your gloves, you didn't do that. Like, you know, now it's my mom. It's not a regular patient, but you pay attention to it, and then it matters to you. But it carries over to when you're talking to your other housekeepers, or you're realizing that other people don't do things. Like, I get into with the housekeepers all the time, because I'm like, take off your gloves. That's just become one of my biggest things, because people think gloves are clean, and they're touching everything now with the clean gloves that are essentially dirty. And you're transmitting stuff, and you don't even notice that you're doing it. You're not doing it on purpose. And then the tiny surfaces around you. So we'll go and clean the room, the bed, and all the big stuff. But again, the handles, the phone, the things that everyone's always touching. It's important to pay attention to that. In your home, it's like the doorknobs, right? Or your bedside table. That's not what you're cleaning every day. You're cleaning the big things that you think carry germs. But there's so many germs on the small things that we touch every day.
The remote control, the refrigerator door handle. You know, you see these things, and in this business, I've learned a lot of things, and I've taken it to the next step. Like Antoinette, you start looking at your own family, you know, and my mother recently was a patient, and the first thing I did was started checking out the environment. Started looking at what's dirty, what's not dirty, what's clean, who's doing what. Are they washing their hands? What are they touching if they're not washing their hands? And I've asked nurses previously, would you mind sanitizing? And it's important because, again, it's all the things they're touching, and no one realizes it. Like Antoinette said, when you wear your gloves, you think you're safe. But then I see those same people with those gloves touching a rail that's dirty, and then they're grabbing their cell phone right after. So are you really protecting yourself, or is it just a false sense of security? And that's what it becomes, is that people start to wear gloves thinking that they're protecting themselves, but they're touching everything, and then they're touching themselves with the gloves and their personal items with the gloves. So it becomes that they're actually doing the opposite. They're now creating an environment of germs.
And then nobody wants to come to a hospital and go home with something that they didn't come in with, right? That's probably not a good feeling. Something that's preventable, something that someone could have washed their hands or cleaned the surface better. And cleanliness also brings a certain peace of mind to at home or when you're ill. That's the one thing you shouldn't have to worry about. Am I in a clean and safe environment? And when we have new staff or new managers, that's the goal of what we provide here, a clean and safe environment, because it gives you the peace of mind that you don't have to worry about that, because you're already ill, you're in pain. Everything else you're thinking about, you know, if you're a mom, you're thinking about your child. If you're, a wife, is my husband, the family, is everyone okay? While you're in the bed and you're not feeling well, you shouldn't have to worry about, is the environment that I'm in clean? That should be a basic standard. And sometimes you hear people talk about, I'd never want to come here. This hospital is this, or this hospital is that. It's dirty. Any hospital that you've been in. That's not a Kings County thing. We've worked in several hospitals, and people say that all the time. And then I'm like, but you work here, so do you really mean that? You don't, because it's one of the best. I would bring my mom here with no problem. I value the way and the cleanliness, and I'm so proud of the way this hospital looks. So I always tell people that, like, actually take a look around you and be proud of it. See the space that you're in. We have one of the cleanest hospitals in the system. And I value that. I always tell people, walk our ED with pride, right? Because go to other EDs, and it's just, I'm proud of what they do and the how they treat the ED, the emergency room, the ICUs, and care of the loved ones there. So that's really important to me.
It also helps with their care. How do you feel when you walk into your apartment that's clean, or your house, or your home, or your office, or a patient room? It makes you feel better. It makes you feel like you can breathe. gives you that sense of security, but you know that you feel better. It brings a smile to your face. And I think it's important to put a smile on our patients' faces, not only to protect them, protect our fellow coworkers, but our families, because whatever we do has a snowball effect to everything we do, to our families, to our friends, because if we're not cleaning and we're not doing the right thing, then we can potentially cross-contaminate our environment and our own homes. So it's important that we do the right job. It's important that our team is paying attention to details. I call them the doctors of dirt. You know, we're part of that care team that allows people to get better. When a patient leaves and they leave in a good state, we're part of that. We're part of helping that person get better, and it's important. It's important for us to do the right thing, to not cut any corners, to make sure that we're following all the steps to ensure our patients are being treated properly, are in a safe, clean environment, and for our coworkers and our families alike. So it's really important that we pay attention to all the little details to make sure that we're mopping properly, that we're using the right chemicals, that we're cleaning the right areas, that we're not missing or cutting any corners, because it affects everyone. It affects the person sitting there, the patient sitting there who chose to come to this hospital. And they chose to come to this hospital over all the other hospitals within the 2 or 3 block radius that we have here. And the difference is us, the people. The people. You know, not just me and Antoinette, it is our team. Antoinette and I are nothing without our team. We're part of them. We're an extension of them. They're not an extension of us.
Yeah, it's definitely us being on their team, right? And I think the pandemic really heightened the sense and the importance of cleanliness in the hospitals and even in our any spaces. I remember during the peak pandemic, us changing our clothes outside because we didn't want to bring it home, or literally, like everyone, it's like, okay, you take your scrubs off in the street and put them in your trunk. That was our life then. So it really is valued more, and I think people walk in and they have so much more of an expectation of cleanliness now because they saw what the importance of it for us was, and how, you know, if we weren't doing that, if we weren't cleaning all the time, how the pandemic and all the other viruses coming out can spread. So it's very important that we follow these practices at work and home.
I think another really good tip for those individuals who are going home and they don't want to, let's say, potentially bring anything home with them, whether you're an environmental service worker or you're working in a hospital, you're coming across germs all day long. I think it's important for us to understand that during COVID, many people, like Antoinette said, would, you know, take off their clothes and change before they walked into their house. We're not in that world right now, but a good practice would be to go straight into your shower, or if you're you know, go into your bathroom, or go into your, you know, if you have a home and you have a mud room, to go into those areas and there take off your clothes, change into something else, you know, shower, make sure you put your clothes in you know, cleaning or in a tub or wherever you put your clothes, to separate that from different clothes, and so that you're cleaning yourself and you're bathing yourself and you're disinfecting, so that when you're touching your family and you're engaging with your family, that you're not potentially passing on any germs. During COVID, we learned a lot of things. We did a lot of things differently, but now we may not be at that world, but we still continue to do some of those things. We still should be wiping down doorknobs, you know, remote controls, refrigerator doors, telephone handles, you know, all those things, light switches. These are all things we touch all the time and people touch all the time. So it's important for us. If you live in an apartment building, it's a little bit more difficult because you're turning the knob that all your tenants turn. You know, you're touching the handrails that all the other fellow tenants touched. So it's important for us, before you go into your house, to again sanitize your hand, make sure that you don't engage with your family members initially, and again, clean yourself, make sure you're sanitized, and make sure your clothes are separate from those of your family as well.
Thank you all for joining us. Once again, I'm Antoinette Williamson.
And I'm Geraldo Acevedo.
And we'll see you on the next episode.